Dr. Amit Arora, and in my medical study channel today we are going to understand the cardiac cycle. So what exactly is the cardiac cycle? It is the sequence of changes in pressure and flow of the blood in heart chambers and blood vessels in between two subsequent contractions or between two heartbeats. So here we have to know about the changes in the pressure and the flow of the blood, not only in the heart chambers as well as in the blood vessels between two subsequent cardiac beats or two subsequent cardiac contractions. That is what exactly is the cardiac cycle. So the events which are taking place between the two subsequent contractions consist of a cardiac cycle. The duration of cardiac cycle is zero point 0.8 seconds. So from one beat to another beat it takes 0.8 seconds. Now what are the events of cardiac cycle? First of all the chambers of the heart are into a relaxed phase. That relaxed phase of the heart is known as diastole. Then the blood fills in the chambers which are relaxing. Then the pressure generates in the chambers and the chamber contract. The contraction phase is known as systole. Then blood is ejected out by opening of the heart valves. So during these phases the blood fills the chambers contract and the blood is ejected out. So the flow of the blood, the pressure develops in the heart, as well as because of the ejection the pressure changes occurs in the blood vessels also. So this whole all the events consist of a cardiac cycle. Now what are the phases of cardiac cycle? The cardiac cycle has two phases: systole, the contraction; diastole, the relaxation. Atrial systole 0.1 seconds, ventricular systole 0.3 seconds, arterial diastole 0.7 seconds, ventricular diastole 0.5 seconds. Now we are going to study these systoles and diastoles, the artery and ventricle, separately, and in my presentation I have tried to explain it with some effects of the animation, so please take a note. Arterial systole. Arterial systole starts when the SA node, which is present on the posterior aspect of the right atrium where the superior vena cava joins the right atrium. So SA node generates the impulse and this impulse excites the arteria, and with the generation of that impulse the arterial systole starts. So you can see the SA node, there is a development or there is a generation of the impulse and the impulse is going through the arteria and making it contract. So then the arterial muscles contract because of that impulse, and as a result of the contraction the pressure in the arteria increases, that is in left arteria as well as the right arteria. All the events which we are going to study in this cardiac cycle, both the arterias have same phases, both the ventricles have same phases. So either we study in right arteria or right ventricle, right arteria or left arteria, the changes are same. So arterial systole starts with the generation of the impulse from SA node. The SA node sends the impulse travels through the arteria and the artery muscles contract, and as a result the pressure in the arteria generates. In the right atria it goes up to 4 to 6 mmHg. In the left atria, which is comparatively more thicker than the right atria, the pressure change goes up to 7 to 8 mmHg. Then that contraction is followed by propelling of the 30% additional blood into the ventricles. Mention it, I have written additional blood. Additional blood means before this phase some of the blood, or you can say the 70% of the blood, have already gone into the ventricle, from right atria to right ventricle, from left atria to left ventricle. This we will discuss later in our cardiac cycle phases. So because of the contraction of the arterial muscle, the additional 30% of the blood is ejected into the ventricles, from right atria to right ventricle, from left atria to left ventricle. So here you can see, then that phase is followed by, now as the arteries are contracting, there occurs the narrowing of the superior vena cava and the inferior vena cava openings of the right atrium, and pulmonary veins openings of the left atrium, so as to prevent the backflow of the blood. So the phase is over by contraction of the arteria with propelling of the 30% of additional blood into the ventricle and narrowing of the orifices of the superior vena cava, inferior vena cava and the pulmonary veins. The atrial systole is followed by ventricle systole, that is either the right ventricle systole or the left ventricle systole. There are two phases of the ventricle systole. One is isovolumetric ventricular contraction and the other is ventricle systole proper. So first phase, isovolumetric ventricle contraction. So as the name suggests, isovolumetric, that means the same volume. So in this phase the contraction कुछ इस तरह का होता है, that is the contraction of a type that there is no change in the actual volume of the any of the ventricles, but still there occurs a contraction. The muscles are into a state of tenseness. Muscles are tense, but the volume of the chambers remains same. Okay. So this phase, till this phase, the SA node impulse has come to the AV node, and from AV node it is to the bundle of His and to the ventricular fibers. So now the ventricles are getting excited. So the ventricles are getting excited from the AV node impulse. This is followed by the ventricles start contracting, and as a result the pressure of the ventricles start increasing than the pressure of the arteries. So ventricles now are excited by the impulse which has started from the SA node. As a result of the contraction, slight changes in the muscles, the tensioning of the muscles is happening, and the blood has already entered into the ventricles. As a result, the ventricles has started contracting. So the pressure in the ventricles has started increasing, and it is now more than the pressure in the arteries. As a result, now you can see there is a happening of the contraction of the muscle. You can see this in the diagram. Muscles are contracting, the volume is same. Now this is followed by, as the pressure in the ventricles is more than the arteries, so as to prevent again the backflow of the blood, the arterial valves close, arteriovenous valves, arterioventricular valves, the arterioventricular valves, that is the mitral valve of the left side and the tricuspid valve of the right side, they close so as to prevent backflow of the blood, and the semilunar valves that are still closed, that is the valves which are present from right artery to pulmonary artery, or you can say the pulmonary valve and the aortic valve, the semilunar valves are closed. Now see, you can see again in the diagram, the arterial muscles are contracting, followed by changes in the pressure in the the ventricle wall is contracting, followed by changing in the pressure of the ventricle. As a result of that pressure changes, the arterioventricular valve close, the semilunar valves are already closed. Now you can imagine the ventricles are closed chambers. The arterioventricular valves are closed, semilunar valves are already closed. So the chamber has become closed. The blood is there in the chamber. The muscles are tensioning. As a result, the pressure is generating in the ventricles. Pressure is generating to an extent that there is no change in the volume of the ventricle. Just there is a change in the pressure of the ventricles because of the tensioning of the muscles. So this is the isovolumetric phase. Now this phase increases the pressure in the ventricles. And now because of the increase in the pressure of the ventricle, the arteriovenous valve bulges slightly into the right atrium because of the developing pressure of the ventricle, or the arterioventricular valve bulges into the left atrium because of the pressure developing in the left ventricle. So because of that bulging, now you can see in the diagram, the bulging happens. of the atrioventricular valve, and as a result of that bulging, the right arterial pressure slightly is raised, not much but very slightly it is raised, so that you can see now. Imagine the pressure changes. So first of all, again, the ventricles are get excited by the SA node impulse, which has come the impulse which has come from SA node. The ventricle is contracting, there is a tensioning of the muscle. As a result of the increased pressure of the ventricle preventing the backflow of the blood, atrioventricular valve is closed. That is followed by the generation of pressure in the ventricle, and as a result of the atrioventricular valve bulges into the right atrium, or the mitral valve into the left atrium. So the whole phase is isovolumetric ventricular contraction. The volume is not changed, but the contraction has started. Now the second phase of ventricular systole is, so one more thing you should know, that in this phase there is no emptying of the blood, just a generation of the pressure. So वेंट्रिकल से ब्लड बाहर नहीं जाता है, जस्ट वेंट्रिकल्स में प्रेशर चेंजेस आते हैं, और वो भी ऐसे कि वेंट्रिकल्स का साइज नहीं कम होता है, इसका वॉल्यूम कम नहीं होता है, सिर्फ मसल्स टेंस हो जाते हैं. नाउ दिस फेज इज फॉलोड बाय वेंट्रिकुलर सिस्टोल प्रॉपर. इन दिस वेंट्रिकुलर सिस्टोल प्रॉपर the ejection of the blood takes place. It is a proper systole, proper contraction, ventricles contract. From the right ventricle the blood is ejected into the pulmonary artery, and from the left ventricle the blood is ejected into the aorta. So as the pressure of the left ventricle increases than aorta, that is 80 mmHg, and the pressure of the right ventricle increases than pulmonary artery, that is 10 to 12 mmHg, the semilunar valves, that is the pulmonary valve as well as the aortic valve, open up. Now you can see as the valves are open up, with the opening of the valve the first phase starts, and that is the ejection phase. So first phase of that ejection phase is rapid ejection phase. Now you can imagine the ventricles were contracting, there was a tensioning of the muscle, the pressure was generated into the ventricle chambers, and suddenly the semilunar valve open up, and as a result of opening of the semilunar valve there is a rush of blood from the ventricles to either the pulmonary artery or from the left ventricle to the aorta. So this rush of the blood in this initial state forms the rapid ejection phase, and in this phase only the 2/3 volume of the blood of the ventricle is ejected out from the ventricles. Okay, so there is a intraventricular pressure rises. In the left ventricle it goes up to 120 mmHg, and in the right ventricle it goes up to 25 mmHg, and there occurs a rapid ejection of the blood, that is the 2/3 of the blood volume of the ventricles is ejected. Now this is followed by rising in the arterial pressure, that is rise up of the pulmonary artery pressure or the rise of the aorta pressure. Then this is because the blood has entered into the pulmonary artery as well as the aorta with a rush, with a force. So there occurs a you can say there is a elasticity in the aorta and the pulmonary artery, so the they just expands up to take that blood, and the pressure in the aorta and the pulmonary artery rises up. Now this is followed by, now you can see, now as the blood is ejected into the pulmonary artery and the aorta, so now the blood has gone out from the ventricle, almost 2/3 blood, so the pressure in the ventricles are decreasing. You can see in the diagram the blood has gone into the artery or the aorta. As a result of the lack of blood, the pressure in the ventricles decreases, and as the pressure in the ventricle decreases, now you can see the atrioventricular valve, which was bulged up during the isovolumetric ventricular contraction into the right atrium, that has now come to its actual position, and as a result of that the right atrium pressure slightly drops. थोड़ा सा, ज़्यादा चेंज नहीं, थोड़ा सा चेंज पहले आया था, which was because of the bulging. Now the bulging has come to its actual state, so the right arterial pressure now slightly decreases because of that. Now the next is the next ejection phase of the ejection is summit of the ventricle pressure. So here the aortic or pulmonary artery pressure slightly exceeds than the ventricle pressure, but because of the momentum of the blood keeps on moving toward the pulmonary artery or the aorta. So clear about the summit. So in this phase, even though the pressure of the pulmonary artery and the aorta slightly raise up, but because of the movement of the blood is still entering into the arteries. Then there is a slow ejection phase, which is the last phase of the ejection phase. Here the ventricle pressure declines, contraction begins to subside, just slow ejection, or you can say the last volume of the blood is ejected out. Okay, so the contraction declines, the pressure declines, and the speed or flow of the blood toward the arteries is also declines. That is the slow ejection of the blood. Now the third stage of the cardiac cycle is ventricular diastole. This ventricular diastole consists of four parts: the protodiastole, isovolumetric ventricular relaxation, ventricular diastole proper, and last rapid filling phase. Now you just see the during the contraction phase, the atrioventricular valve is closed, the blood has gone out from the ventricle to the arteries, the pressure has started declining in the ventricles, so that ventricular diastole phase starts with the protodiastole. That is, it is the stage which just starts at the end of ventricular systole, when the ventricle pressure declines or drops down with all the blood which has entered into the arteries, and with the filling of the arteries there happens a elastic recoil of the aorta or the pulmonary artery. That is, the blood entered into the, just a second, that is the blood entered into the arteries, and you can just say that wind castle vessel effect, and as a result the arteries expanded, and now because of the elasticity of the arteries they are elastic recoiling, they are coming back to their actual position. So as a result of that elastic recoiling, the blood is there, the artery walls are coming back to its original position, so the pressure in the arteries increase up. So ventricular pressure declining and arterial pressure increasing, and as a result of increased pressure of the arteries, the semilunar valves, that is between the pulmonary valve and the aortic valve, closes. So protodiastole phase starts with the end of the ventricular systole and the closing of the semilunar valves. Now you can see the semilunar valve is closed. You can see in the diagram the semilunar valve is closed. So now again the ventricle is a closed chamber. Semilunar valve is closed, atrioventricular valve is already closed, and there is no blood in the ventricles. The ventricle muscles are relaxing. So phase protodiastole is over. This protodiastole phase is followed by isovolumetric ventricular relaxation, that is complete relaxation. But again the term isovolumetric, again no change in the volume happens, the muscles just relax, the tension of the muscles is relaxing, but no change in the volume of the ventricles. So ventricular muscles relax without change in the ventricular volume. Here the pressure in the ventricles falls below the pressure of the atria. Now this needs to be understood. uh, you learned that in atrial systole there was an atrial contraction and additional 30% blood was entering from the artery to ventricle. Now in this phase, when the isovolumetric ventricular relaxation, when the ventricle muscles are relaxing, so the changes happens that pressure of the ventricle is now less than the pressure in the atria, and because of that decreased pressure of the ventricle compared to the atria, the atrioventricular valve just open up passively without any force. There is no force on them. Just because of that pressure changes, the atrioventricular valve opens up passively, and because of the opening of the atrioventricular valve and with the effect of the gravity, almost 70% of the blood from the atria to ventricle comes up. So you can now understand why I use the term additional. So in isovolumetric ventricular relaxation, ventricle muscle relax without changing the ventricle volume. The pressure of the volume of ventricle falls below the pressure of the atria, and as a result AV valves open up, and that leads to filling of the ventricles. You can see in the diagram, the ventricle is a closed chamber, the pressure in the ventricle is declined as compared to the atria, and as a result the atrioventricular valve opens up and the blood comes and fills the ventricles. See, clear? So you can see the closed atrioventricular valve followed by opening of the atrioventricular valve and the rush of blood from the atria to the ventricles with the effect of the gravity. Just so passively, there is no contraction is happening anywhere. See, then this phase is followed by ventricular diastole proper. So 30% of the ventricles fill up passively. कोई contraction force अप्लाई नहीं हुआ, कहीं से कोई contract नहीं हुआ, atria contract नहीं, just because of the opening of the valve and with the effect of the gravity, the ventricles are filled up. So this ventricular diastole proper consists of three phases. Initial rapid filling, with the opening of the AV valve, the whole blood just rushes up into the ventricle, and so initial rapid filling. It begins with the opening of the AV valve. The pressure in the ventricle remains low as ventricles continues to relax. So in this phase also the ventricular pressure remains low as they are relaxing. अभी तक उनमें contraction phase generate नहीं हुआ. Contraction phase generate कब होता है? When the impulse comes up. No impulse is coming up from the SA node. Ventricles are relaxing, blood is filling the ventricles, and still their muscles are relaxing. Okay, the initial rapid filling followed by slow filling phase, that is diastasis. You can see the timing of these phases. Now you can imagine the blood is coming from superior vena cava into the inferior vena cava into the right atrium, or through the pulmonary veins into the left atrium. Atrioventricular valve is open, 70% blood has also gone into the ventricle, and still the atrioventricular valve is open because pulmonary ventricle pressure is low. So the blood which is coming from superior vena cava, inferior vena cava to right atrium or pulmonary veins to left atrium is directly going into the ventricles. There is a slow filling phase, so continuous venous return filling both atria as well as the ventricles, followed by last rapid filling. Now this last rapid filling is due to the atrial systole. So when the ventricles are relaxing, in that phase only the atrial systole comes and goes away, that is just 0.1 second. So last rapid filling phase of ventricular diastole proper is due to the atrial systole, which propels the additional 30% blood into the ventricles. Now the last phase of the cardiac cycle is atrial diastole. During this phase the atrial systole has completed in the last filling phase of the ventricular diastole. Okay, so last rapid filling phase के दौरान atrial diastole ventricular diastole के last rapid filling phase के दौरान atrial systole तो complete हो गया. Now this is followed by atrial diastole of 0.7 seconds. Here the atrial muscle relax. Arterial pressure gradually rises due to the venous return, but वो venous return which comes into the atria directly goes into the ventricle because valves are open. So there is a slight increase in the pressure of the atria, and which drops down to zero with continuous coming of the blood and opening of the atrioventricular and going into the ventricles. But during this phase the ventricle diastole, you can just see the diastasis phase of the ventricle. So there is a continuous venous return filling both the atria and ventricles, followed by the atrial systole. Now this is followed by Atrial diastole, the muscle relax, arterial pressure rises due to venous return and drops down with continuous opening of the AV valve. Then pressure rise again during the diastasis phase of the ventricular diastole proper. So the pressure in the arteries rise again during the diastatic phase of the ventricular diastole proper. And जब ventricular diastole proper में diastasis phase हो रही थी, जब ब्लड आ रहा था और जा रहा था वेंट्रिकल्स में, उस दौरान आर्ट्रिया अपना डायस्टोल कर रहे थे और डायस्टोल पूरा होने के बाद अपने सिस्टोल की तैयारी कर रहे थे ताकि लास्ट 30% ब्लड भेज सके. सो आर्टियल डायस्टोल कंसिस्ट ऑफ रिलैक्स्ड मसल्स ऑफ द आर्ट्रिया. Pressure rises, drops down to zero because of the continuous venous filling and going into the ventricles. Then the pressure starts following, क्योंकि यहाँ पर एसए नोड से इम्पल्स आनी शुरू हो गई है. और वो फेज कब होता है? डायस्टेसिस फेज ऑफ द वेंट्रिकुलर डायस्टोल प्रॉपर. सो स्लाइट प्रेशर इंक्रीज, बट अभी इम्पल्स आई नहीं है. दिस इज जस्ट स्लाइट इंक्रीज इन द प्रेशर, एंड एज इम्पल्स कम्स आर्टियल सिस्टोल्स हैपन. So this is all about the cardiac cycle. So thank you. Keep your heart moving, healthy and happy. Please subscribe to my channel if you like it, and be ready for more updates.